Chapter 9 focuses on the digestive system. The objectives live in the modules still. The GI tract is the main structure of the digestive system. The upper GI tract is composed of the mouth, the pharynx, the esophagus, and the stomach. So what does that leave us with? The lower GI tract, which is everything below the stomach. Includes the small and large intestines, the rectum, and the anus. Other structures are the liver and the gallbladder and the pancreas. The beginning of the GI tract is the mouth. The lips or labia surround the mouth. The palate is the roof of the mouth. The hard palate is the anterior part, towards the front of the mouth, that is. Well, hard, just like the name says. The soft palate is the posterior palate, that is soft. During swallowing, it closes off the nasal passages. The uvula is that dingleberry that hangs from the soft palate at the back of the throat. The tongue is located in the oral cavity, and it's a strong, flexible muscle. The dorsum is the upper surface. The sublingual surface is under the tongue. The lingual frenulum is that band of tough tissue that is found under the tongue. Papillae is the tough covering of the tongue that is super bumpy. The periodontium are the structures that surround, support, and are attached to the teeth that include the gingiva or gums, and the sulcus, which is the space between the teeth and the gums. There are two dental arches, the maxillary and the mandibular. The temporomandibular joint is where the two arches join. Teeth are used for binding, grinding, tearing, and chewing. We have 20 baby teeth and end up with 32 permanent teeth. Parts of the tooth are the crown, which is the top part. Think crown, where does it go? On the top, right? The root holds the tooth in place, and the cervix is the neck. The dentin is the part above the gum line. The pulp is the blood vessels and nerves. There are salivary glands in the mouth. Parotid is inside the cheek. Sublingual, sub is under, and ling is tongue. So an AL is pertaining to. So pertaining to under the tongue is where the next set of salivary glands are. The submandibular glands are where? Under the mandible. They secrete saliva, which is spit, a clear liquid that moisturizes and contains digestive enzymes. The pharynx is the passageway to both the digestive and respiratory system. The epiglottis is like a lid that closes off the trachea. The esophagus is the tube that joins the mouth to the stomach. The distal end of the esophagus has a sphincter called the cardiac sphincter. It is between the esophagus and the stomach that relaxes when we swallow and allows food to go into the stomach. It also closes to prevent the contents from going back up into the esophagus. The stomach is like a big bag that holds whatever comes down the esophagus. The upper part, that is round, is called the fundus. The body is the main portion, and the antrum is the lower part. There are many folds in the lining of the stomach called rugae. Gastric, gaster is stomach, and ick is pertaining to. Juices are released in the stomach to help with digestion. The pyloric sphincter is a muscle ring at the base of the stomach that controls the flow of food into the small intestines. The pylorus connects the stomach to the small intestines. The small intestines start at the pyloric sphincter and end at the beginning of the large intestines, and then can measure up to 20 feet in length. There are 3 sections. The duodenum, or duodenum, is the first part. The middle portion is the jejunum, and the ileum is the last and longest part. The large intestine starts at the end of the small intestine to the anus. It's wider but much shorter than the small intestines. The cecum is a small pouch that contains the ileocecal sphincter. This sphincter controls flow from the small to the large intestines. The appendix hangs from the lower portion of the cecum. The large intestines consist of the colon, rectum, and anus. The large intestines have 4 sections and tells us how they are positioned in the abdominal cavity. Ascending is from the cecum and goes up from the cecum to under the liver. The transverse colon lies transversely to the other side of the abdominal cavity. The descending colon goes on the left side of the body down to the sigmoid colon. The sigmoid colon is shaped just like an S and joins the descending colon to the rectum. The rectum is the widest part of the colon and ends in the anus, where there is an anorectal sphincter to control flow of waste products out of the body. Sometimes it works better than others. Which cavity has the lips, palates, tongue, and teeth? The oral cavity. Accessory organs are the liver that removes toxins from the blood and helps turn the food we eat into energy that we use. It helps with digestion of fat and hemoglobin. The biliary tree is a system of tubes that bile travels through. The trunk of that tree is the common hepatic duct. The gallbladder is located under the liver and stores the bile. The pancreas is also part of the endocrine system located posterior to the stomach. Where is that? Behind, correct. It makes pancreatic juices that also help in digestion. What's the largest organ? You don't even need to know anything except for what chapter we're in. A and B are out, so what's bigger? The liver, exactly. Digestion is how we break down the food we eat into nutrients our cells can use. Enzymes help with the breakdown. Nutrients are provided to the body in different forms like fats, carbs, or proteins. Micro, small, nutrients are those nutrients you only need a small amount of. Metabolism encompasses all of the ways that the body uses nutrients and consists of 2 parts. Anabolism, which is the buildup of cells from nutrients, and catabolism, which is the breaking down of cells, releasing energy and carbon dioxide, or CO2. Absorption is the transporting of nutrients to the cells. Villi are little fingers that line the inside of the small intestinal wall. They contain blood vessels and lacteals, remember from the lymph system, and absorb nutrients from the intestines to the bloodstream. Lacteals also absorb fat and fat-soluble vitamins, which are transported through the lymph vessels. The mouth, salivary glands, and esophagus have several roles. Mastication or chewing to break down food and mix with saliva starts the digestive process. This creates a bolus, which is a chunk of food that has been prepared by mastication for swallowing. Peristalsis is a wave-like contraction that helps to move the food along the digestive tract from top to out. The stomach mixes the food with the gastric juices to break it down. The end product is chyme, that is partially digested food that is passed into the small intestines. The role of the small intestine is to convert that food into substances that the body can use. The chyme moves through via peristalsis, which is a smooth muscle function. The duodenum is where the chyme mixes with the enzymes from the pancreas and the gallbladder. The jejunum also creates enzymes, and the ileum absorbs the nutrients. The large intestines receive and stores and eliminates the waste products. Defecation is pooping. Gut microbiota refers to the billions of bacteria in the large intestines. These bacteria help to protect against infection and maintain the immune system. Borborygmus is the noise that is made when our stomach rumbles. Flatulence or flatus is farting. Fun facts. What secretes large amounts of enzymes to continue digestion? The wording tells you something about the location of the organ. The jejunum, right? It's in the middle, so it's continuing, not at the beginning. And the ileum is mostly about absorption of nutrients. Here are some medical specialties associated with the digestive system. Who does surgery of the face or jaw? Well, the only one who is a surgeon. Important slide that looks at essential word parts associated with the digestive system. Here's a question approach that you all have to learn. What is the question? The question is not what cholelithiasis means, but what does lithiasis mean? A lot of times when we're skimming, we are not reading the question, and they tend to try to trick you to see if you're paying attention. The presence of stones. What can go wrong in the oral cavity? Canker sores or aphthous ulcers that we can get with food reactions, fever, or stress. Cheilitis is inflammation of the lips. Leukoplakia is a benign lesion on the tongue or the inside of the cheek. Stomatitis is inflammation of the inside of the mouth. Oral thrush is a yeast infection in the mouth. Trismus is lockjaw, and xerostomia is dry mouth. A cleft lip or palate are birth defects where the lips or the palate do not fuse together during embryonic development. This not only can be devastating in terms of social impact, but can make speech development difficult. Dental problems happen when we grind our teeth, bruxism, or we have cavities, caries, or have plaque buildup that is bacterial buildup. Edentulous means without teeth. That's the ultimate dental problem. Halitosis is bad breath. Malocclusion is where the top and the bottom teeth do not fit together normally. And periodontal disease is disease involving the gums. For the esophagus, you can have difficulty swallowing, dysphagia, or inflammation, esophagitis. You can have backward flow of chyme from the stomach called gastroesophageal reflux, or you can have changes in the cells themselves from chronic acid exposure with Barrett's esophagus. You can have a narrowing or a stricture. Pyrosis is heartburn. Think of pyro as on fire, right? Varices are like varicose veins, but in your esophagus. And a hiatal hernia is where part of the stomach sneaks through the diaphragm's opening. Disorders of the stomach are gastritis or inflammation of the stomach. Gastroenteritis is inflammation of the stomach and intestines. And gastroparesis is where the motility of the stomach is slow and delays stomach emptying. You can have an ulcer anywhere. Peptic ulcers occur anywhere in the GI tract. Gastric is obviously in the stomach. Duodenal is in the duodenum. perforated ulcer is where the ulcer eats through the gastrointestinal wall. Disorders of nutrition include anorexia, which is also a mental health disorder. Cachexia is where the body is wasting away due to loss of muscle mass and weight, which can be a sign of an anorexia or a chronic condition such as cancer. Failure to thrive is a pediatric term when babies or children don't meet their growth and development expectations. You can be dehydrated when you don't have proper fluid intake or malnourished when you don't have proper food and nutrient intake. Malabsorption is where you cannot absorb the nutrients from food into the body. On the other end of the spectrum is obesity, where the BMI or body mass index is greater than 40. Indigestion and vomiting are signs of pathology of the digestive system. Emesis is vomiting, so hyper means excessive. So hyperemesis means excessive vomiting. Heme is blood, right? So hematemesis is bloody throw up. Eructation is burping. Not sure how pathological that is. Aero is air and phage is to eat. So aerophagia is swallowing a lot of air when eating or drinking. Intestinal disorders include things like celiac disease, which is an autoimmune disorder, lactose or gluten intolerance, where you cannot properly digest lactose or gluten products. Colorectal cancer is exactly what the name implies. Diverticulosis is like many tiny little outpatchings or hernias in the colon wall. And when they get inflamed, it's called what? Diverticulitis. Exactly. Enteritis is inflammation of the small intestines. Ileus is a partial or complete block of the small or large intestine. Irritable bowel syndrome, or IBS, is intermittent cramping, bloating, and either constipation or diarrhea. Inflammatory bowel disease is very different from IBS. The intestines are swollen and inflamed, which causes ulcers. Ulcerative colitis affects large intestines and the rectum. Crohn's disease can occur anywhere in the GI tract. It's considered to be an autoimmune disease. All layers of tissue are affected, and an intestinal obstruction is a common complication. Types of obstructions are strangulating, where the blood flow is blocked. A volvulus is a twisting obstruction. A strangulated hernia is where the intestine is squeezed tightly through an opening, causing obstruction and constriction of circulation. Infectious diseases include bacterial infections like C. diff, E. coli, salmonella, or dysentery. Problems with flow out can be diarrhea, remember rhea means flow, incontinence, poop your pants in other words, or constipation. Anal fissures are cracks in the skin that lead to sores. Hemorrhoids are clusters of circulatory vessels with the tissue that slips out of the anus. Rectocele is a bulging of the front wall of the rectum into the vagina. And abnormal types of poop are hematoschezia, which is bright red blood, or melena, which is dark gooey poo that has blood in it. Steatorrhea is fatty poop. Gross. Liver disease includes ascites, which is fluid accumulation in the peritoneal cavity. Hepato is liver, megaly is enlargement, so hepatomegaly is enlargement of the liver. Jaundice is where the skin appears to be yellow due to bilirubin in the blood, and hepatitis is what? Inflammation of the liver. If y'all don't know what itis is by now, you have not been paying attention. Cirrhosis of the liver is scarring due to alcohol abuse, infection, or inflammation due to excessive fat accumulation. Col has to do with the gallbladder. So cholangitis is inflammation of the bile duct. Cholecystitis is inflammation of the gallbladder itself. And if lith is stone, then cholelithiasis is a gallstone. What is the term used to describe a pathology with severe reaction to gluten? Celiac disease. And how do we diagnose diseases of the digestive system? CT, MRI, and X-rays using contrast, ultrasounds, and scopes. We can also examine the stool or poop or feces. Some diseases can be diagnosed by using the gases emitted through the upper GI or GI system. Using a scope to visualize the GI tract is called an endoscopy. The root will tell you where the procedure is going to be focused. For example, colonoscopy is looking at the colon, sigmoidoscopy is looking at the sigmoid and below. We can also test the stool for blood if it isn't obvious. And how do we treat diseases of the GI tract? Depends on what it is, right? We go to the dentist for cavities and root canals and bite guards. We go to the surgeon to repair defects or disease processes. We can ingest things to help restore the balance of good bacteria in our guts and take vitamins. Antacids, proton pump inhibitors to help reduce acid in our stomachs. Antiemetics are used when we are nauseous or vomiting. Laxatives help us poop, and antidiarrheals help us stop. We can also rehydrate when we lose too much water with either oral or intravenous fluid. There are several ways to support a patient nutritionally. Extremes would be through a tube through the nose or direct from the surface of the abdomen to the stomach called a gastrostomy, or with concentrated nutrients that bypass the GI system completely called total parenteral nutrition or TPN. This is what an NG tube looks like. Naso is nose, gaster is stomach. So a tube from the nose to the stomach. Bariatric surgery is used to treat morbid obesity. There are several types that range from a band at the esophageal sphincter that restricts the food, amount of food going in. This is reversible. The gastric sleeve is where the stomach is made 3/4 smaller by suturing part of the stomach. There's also the most extreme, where the stomach is reduced to a small pouch by stapling it, essentially bypassing the stomach. Here are some various other treatments used for diseases of the GI or digestive tract. There is no end in sight to what we can do to our organs. Look at the root. It tells you what the organ we are talking about in the digestive system. Then look at the suffix, which tells you what is being performed. Hepat is liver. Ectomy is removal, so removal of the liver. Which one treats severe obesity? You don't even really need to know. B and C are ectomy. What does that mean? I just told you, right? It means removal. Are you removing obesity? No. D is ostomy, which is the surgical creation of a hole. Are you doing that? No. The only answer left is A, bariatric surgery. I'm just going to pronounce these terms. Cholangiography, cholangitis, ascites, esophago-gastroduodenoscopy, gastroduodenostomy, and xerostomia. Which one of these is spelled correctly? Ascites, the shortest one. Here are some common abbreviations associated with the digestive system. Which one means FTT? Failure to thrive.